2020 has been an unprecedented year in the world of healthcare. These have been difficult days. COVID-19 slowed us down, but it did not stop Pikeville Medical Center from seizing opportunity through some of the most challenging times any of us have ever lived through. During a global pandemic, PMC was able to begin construction on a $6.3 million project to construct and equip the region's only children's hospital and pediatric clinic. Thanks to AML Grant Selection Committee and the overwhelming support of Congressman Hal Rogers, Governor Andy Beshear, and ARC's Tim Thomas, our dream of developing a children's hospital is becoming a reality. The Children's Hospital is part of an overall plan to begin expanded pediatric services and improve the future of healthcare to the children of our region. Upon completion, the PMC Children's Hospital and Pediatric Clinic will bolster the region's healthcare industry, diversify the economy, and strengthen the workforce. It will be a remarkable win for our entire area. PMC's emergency department is also undergoing renovation to make an entire designated area for pediatric patients. Our ED was recently named as a pediatric-ready emergency department, making it only one of 4 hospitals in Kentucky to receive this accreditation. It is also the first ED in Kentucky to become a certified autism center. In addition, the ED is using some of the most advanced equipment for pediatric patients. And for the tiniest of our patients, PMC was granted a certificate of need that elevated our NICU to a level 2 advanced unit. This allowed us to care for premature babies born as early as 28 weeks and to double the number of NICU beds, going from 8 to 16. PMC is the only medical center in the region with this capability. At a time when so many people are losing their jobs, Pikeville Medical Center has been blessed with the opportunity to create jobs. In July, we opened the doors to the region's first center dedicated solely to treating children who have been diagnosed with autism spectrum disorder. The new Appalachian Valley Autism Center focuses on early intervention to children throughout the region by offering applied behavior analysis therapy, which has become the gold standard of care. It can increase communication skills, improve attention, and decrease problem behaviors. Since opening, the AVA Center has already expanded out of the tremendous need for services. The plans are for the initial 3,300 square feet facility to grow into a standalone 4-story complex with over 28,000 square feet of space, designated to our learners, as we call them. We currently provide classrooms for 45 children. With the help of the state, federal, and private funding agencies, our goal is to expand to between 80 and 100 children. We have hired 25 new positions for the center this year and expect to add another 75 over the next 18 months. When school systems in Pike County resumed in-person classes last month, PMC was there to offer additional support through telehealth services. This service was made available thanks largely to a $357,000 grant from USDA Rural Development and the leadership of State Director Hilda Legg. PMC is now providing service to all Pike County elementary and high schools and is looking to expand. Students and staff attending in-person classes and requiring medical attention can now be seen via telehealth by one of PMC's providers. Many students live as much as an hour away from a healthcare provider. Taking a child to see a doctor isn't always possible for parents when considering work, travel, and financial hardships. Now they can see a PMC medical provider without leaving school. Not only are we focused on the healthcare of our younger students, but also the education of those choosing to enter into the healthcare field. Nursing is one of the areas where there is a tremendous shortfall in the state and in our nation. During last year's SOAR Summit, I announced a new initiative led by PMC and Congressman Hal Rogers and supported by Governor Andy Beshear. The initiative is called Project HEART, Healthcare Employment Around Regional Training. In Kentucky, we continue to struggle to graduate the number of registered nurses needed to care for our aging population. Predictions are that the U.S. will require 400,000 new nursing assistant positions and an additional 1 million registered nurses by 2030. PMC employs nearly 900 nurses and more than 200 nursing assistants. Last year, we needed to fill almost 150 new nursing positions and over 60 nursing assistants. In our immediate community, 2 years ago, our local institutions only graduated approximately 90 RNs each year. Through partnerships with the University of Pikeville, Big Sandy Community and Technical College, Congressman Hal Rogers, and Governor Andy Beshear, we are addressing this need. In the last 3 years, UPike has raised its graduating nursing classes from 30 to 90 students. With the help of a $500,000 federal grant from ARC, a partnership with Congressman Rogers and Governor Beshear and Big Sandy Community College's President Sherry Zilka, we are currently constructing a new nursing school in downtown Pikeville in a building owned by Pikeville Medical Center. PMC is providing 11,000 square feet of space to Big Sandy at only $1 per year. while an ARC grant is contributing an additional $500,000 in supplies and construction costs. This January, Big Sandy will host their first cohort of 35 nursing students. They will also increase their class size on the Prestonsburg campus and certify 20 nursing assistants and 10 phlebotomists on the Pikeville campus. There is no doubt that a job will be waiting for each graduate. This is only one example where collaboration and funding have and will make an impact. There has been over $70 million in capital projects invested through PMC over the past 2 years. We have completed multiple projects including 4 new clinics located in Martin, Whitesburg, South Williamson, and Prestonsburg, a new primary care clinic, automated lab and pathology department expansion, new location and renovations for the sleep lab, new IP lab on the 11th floor, new cancer specialty pharmacy, Starbucks in Corner Market, new call center and coding departments that hired almost 50 new employees in the past 18 months, new 24/7 outpatient retail and specialty pharmacies, and most recently, a new heart and vascular renovation and expansion. PMC is now consistently among the state's leading hospitals in volume and outcomes for heart and vascular procedures. The $35 million expansion of the Heart and Vascular Institute will be completed on November the 9th. The ultra-modern space includes a new cardiac rehab department, 29 exam rooms, 2 waiting rooms, 2 new electrophysiology cath labs, and a new cath lab, each with control rooms and 6 pre-post operative bays. What a great facility to serve those who need it most. Also, fighting cancer has been a focus of PMC for nearly 75 years. It has always been our mission to search for the latest advancements in treatment and technology. Recently, we have relocated our cancer center and added a $1.1 million specialized cancer pharmacy. We've invested in state-of-the-art 3D mammography, a process for baseline screening available in fewer than half the hospitals in the United States. We are in the process of purchasing 2 new revolutionary $7 million linear accelerators, which will enhance our capability to fight cancer through radiation. It will enable us to detect and treat more types of cancers than anyone else in our service area. For patients whose cancer has been non-responsive to traditional therapies, we have been approved for and are offering clinical trials for several types of cancers, including breast, pancreatic, bladder, and 2 different lung studies. Our next big project will expand the cancer center by over 7,000 square feet on the clinic building's 11th floor. Our outpatient pharmacy has taken significant steps to better serve area patients with a retail specialty pharmacy opening. Patients can walk in for prescription drop-off and pickup. The new space features private rooms for immunizations and consultation, while offering over-the-counter medication. It will house the region's only specialty pharmacy, focusing on administering medications for complex or rare health problems. The new pharmacy has the latest generation of automated prescription filling technology. It empowers pharmacists to do even more through high-speed automation, enhancing safety, accuracy, and efficiency. PMC continues to be the region's only 24/7 pharmacy. The 3-lane drive-thru remains open for patients who prefer the drive-thru option. These are just a few examples of how our visions are becoming a reality through partnerships and a lot of hard work. All these projects help PMC fulfill our mission statement to provide world-class healthcare in a Christian environment. Expanding services, providing new jobs, supporting existing jobs, adding construction jobs, new tax space, creating demand for local purchases, and supporting business growth in and around the region enables us to fulfill an enormous need for the economy as well. Although healthcare is our focus, Pikeville Medical Center has become more than just a community hospital. PMC is one of the leading economic engines east of I-75. As a 348 licensed bed regional referral center, we are the largest single employer in our region and the single largest hospital in the 5th Congressional District. We have a patient base of approximately 450,000 people and currently employ over 3,000 professional healthcare workers. We have been aggressive with our growth plan over the past 3 years. Rural communities have an extraordinary opportunity to improve their economy and develop healthcare as an industry. Every healthcare service provided locally benefits the community twice. First to the patient, and secondly to the economy. In our last fiscal year, more than $260 million in wages were paid. Our employees generate a huge tax base for the federal, state, and local governments. In Pike County, PMC produces over 25% of the county's total wages. PMC's compound economic benefits for restaurant visits, retail spending, hotel stays, and other purchases are nearly $98 million annually. Investments made at PMC benefit the entire region. At PMC, we aren't merely forecasting jobs. We are one of the few institutions in Eastern Kentucky that is actually creating them. And with a job retention rate of around 90%, we are also keeping them. We currently have 200 job openings and expect to add an additional 350 new positions in the next 18 to 24 months. Pikeville Medical Center has one of the most robust, lucrative pay and benefits packages, which aids in attracting high-quality candidates. In August, Forbes magazine listed PMC as one of the 4 top employers in the state and the highest-ranking hospital in Kentucky. We cannot do this without many local, state, and federal partners that are here today. Together, we will create jobs, retain jobs, serve businesses, support communities, strengthen households, improve health, and save lives. Because together, we are effective. Together, we rise.